An overactive bladder, OAB, causes a sudden urge to urinate. It can also trigger involuntary loss of urine, known as incontinence. Overactive bladder affects about 33 million Americans. Women are more often affected than men. It can be difficult to manage symptoms because an overactive bladder may be unpredictable. This can cause some people with the condition to limit their social activities, which can affect the quality of your life. It can also trigger isolation and emotional distress. But there are several treatments available that can help you manage your symptoms. Treating overactive bladder can also improve your outlook and reduce incidence of incontinence. Overactive bladder symptoms. Experiencing occasional incontinence doesn't mean you have an overactive bladder. Urine leakage can happen for other reasons, like if you're laughing too hard. You may also experience loss of urine if you've been fighting the urge to urinate for an extended period of time. An overactive bladder is determined by the frequency and urgency of urination. Symptoms include an urgent and uncontrollable need to urinate, frequent involuntary loss of urine, frequent urination more than 8 times in a 24-hour period, waking up more than once a night to use the bathroom. Symptoms of overactive bladder can change. They may be different from person to person, too, which can make identifying the issue difficult without a doctor's help. Knowing the symptoms of overactive bladder can help you find better treatments faster. Overactive bladder causes. Your kidneys produce urine and that urine travels to your bladder. Then, your brain sends signals that tell your body to urinate. Your pelvic floor muscles relax and allow urine to exit your body. An overactive bladder causes your bladder muscles to contract involuntarily. This gives the sensation of needing to urinate frequently even if your bladder isn't full. Different conditions and factors can cause symptoms of OAB. Drinking too much fluid, taking medications that increase urine production, urinary tract infections, consumption of caffeine, alcohol, or other bladder irritants, failure to completely empty the bladder, bladder abnormalities, such as bladder stones. The exact case of an overactive bladder is unknown. The risk of developing this condition increases with age. But an overactive bladder isn't a normal part of aging, so you shouldn't ignore symptoms. Seeing your doctor can help make sure you get the correct diagnosis. Bladder function relies on good urinary tract health. The causes of overactive bladder are often the result of issues in your urinary tract. Overactive bladder diagnosis. Your doctor may complete several tests in order to diagnose the cause of your overactive bladder symptoms. Your doctor may also refer you to a specialist who treats issues with the urinary tract. These doctors are called urologists. Tests used to diagnose overactive bladder include urine sample urinalysis. A sample of your urine is collected and then tested for any abnormalities, including blood. A urinalysis can help identify a urinary tract infection or other urinary tract problems. Physical examination. This allows your doctor to feel for tenderness around your abdomen and kidneys or check for an enlarged prostate. Bladder scan. This test uses an ultrasound to measure the amount of urine left in your bladder after you urinate. Urodynamic testing. This assortment of tests can assess the bladder's ability to hold and store urine. Cystoscopy. During this test, your doctor inserts a lighted scope into your bladder while you're sedated. A cystoscopy helps your doctor determine if your symptoms are caused by any abnormalities within your bladder, such as bladder stones or tumors. Biopsies can be taken as well. Your doctor or urologist may use additional tests to help rule out or confirm an overactive bladder diagnosis. Read more about each of these tests and what you need to do to complete them. What home remedies work for an overactive bladder? Always check with your doctor before taking any herbal supplements. They can interact with medicines you are taking and cause unintended side effects. Chinese herbal blends. Gosha Jinki Gan (GJG) is a blend of 10 traditional Chinese herbs. Several studies have been done on this herbal blend, and researchers found trusted source that GJG inhibits the bladder and significantly improves daytime frequency. People who took 7.5 milligrams of GJG a day also reported trusted source better results on their International Prostate Symptom Score (IPSS), which records urinary symptoms. Another Chinese herbal medicine is Hachimi Jiao Gan He. He is made up of 8 natural ingredients, some of which are also in GJG. Preliminary studies trusted source show that he may have an effect on bladder muscle contraction. Shop online for Gosha Jinki Gan supplements. Ganoderma lucidum, GL. Also known as Lingzhi mushroom, this extract from East Asia is used to cure many ailments including hepatitis, hypertension, and cancers. In a randomized study, 50 men reported better scores for IPSS. This study trusted source recommends 6 mg of GL extract in men with lower urinary tract symptoms. Shop online for Ganoderma lucidum supplements. Corn silk, Z maize. Corn silk is the waste material from corn cultivation. Countries from China to France use this as a traditional medicine for many ailments, including bedwetting and bladder irritation. It may help with strengthening and restoring mucous membranes in the urinary tract to prevent incontinence, according to the International Continence Society. Shop online for corn silk supplements. Capsaicin. Capsaicin is found in the fleshy part of chili peppers, not the seeds. It's commonly used to treat pelvic pain syndrome, which is often a symptom of OAB. Studies trusted source have found that peak bladder capacity increased from 106 ml to 302 ml. Shop online for capsaicin supplements. Read more about supplements that help your OAB symptoms. Side effects. Always talk to your doctor before trying alternative remedies for your OAB. They may cause unintended side effects. Make sure you buy your herbs from a reliable source. Herbs from unreliable sources may be contaminated, and many don't have a standard dose. Many herbs aren't well researched and don't go through quality control processes or human trials to prove their effectiveness. What can I eat or drink for my overactive bladder? Pumpkin seeds. Pumpkin seeds are packed with omega-3 fatty acids, which have anti-inflammatory properties. One study trusted source found that pumpkin seed oil improves abnormal urinary function and reduces symptoms of OAB. Another Japanese study found that pumpkin seeds and soybean seed extract also significantly reduced incontinence. Participants took 5 tablets of this processed food 2 times a day for the first 2 weeks and then 3 tablets a day for the next 5. Shop online for pumpkin seeds. Koki tea. Koki tea is the extract of a subtropical plant in southern China. This sweet tea is sold over the counter in Japan and is high in antioxidants. It's also shown to have protective effects on the bladder. One study found that Koki tea had a significant protective effect on bladder function and contractile responses in rabbits with partial bladder obstruction. Other bladder-friendly drinks include plain water, soy milk, which may be less irritating than cow's or goat's milk, less acidic fruit juices, such as apple or pear, barley water, diluted, squash, caffeine-free teas like fruit teas, eating to reduce constipation. Sometimes constipation can place extra pressure on your bladder. You can prevent constipation by exercising regularly and including more fiber in your diet. Foods high in fiber include beans, whole wheat breads, fruits, and vegetables. The Cleveland Clinic recommends eating 2 tablespoons of a mixture of 1 cup of applesauce, 1 cup unprocessed wheat bran, and 3/4 cup of prune juice every morning to promote bowel regularity. What foods and drinks to avoid? While you may want to drink less liquid so you don't have to urinate as often, you should still make sure you stay hydrated. More concentrated urine, usually darker in color, can irritate your bladder and cause more frequent urination. Other foods and drinks can contribute to OAB symptoms, including alcohol, artificial sweeteners, chocolate, citrus fruits, coffee, soda, spicy foods, tea, tomato-based foods. You can test which drinks or foods irritate your bladder by eliminating them from your diet. Then reincorporate them one by one every 2 to 3 days at a time. Permanently eliminate the particular food or drink that worsens your symptoms. Other irritants. You can reduce the amount of times you get out of bed by not drinking 2 to 3 hours before you sleep. It's also recommended to refrain from smoking. Smoking can irritate the bladder muscle and cause coughing, which often contributes to incontinence. What can exercise do for an OAB? Losing weight. Extra weight can also increase the pressure on your bladder and cause stress incontinence. Stress incontinence is when urine leaks after you do something that increases pressure on the bladder, like laughing, sneezing, or lifting. While eating healthy foods can help you lose excess weight, getting regular exercise like strength training can help with long-term management. Research shows that women who are overweight and have incontinence had less episodes of OAB. One study found that women with obesity who lose 10% of their body weight saw improved bladder control by 50%. Simple exercises to overcome an overactive bladder. Kegel exercises and muscle training. You can also do special pelvic floor exercises, or Kegel exercises, in addition to regular exercise. Kegel exercises strengthen the muscles to minimize involuntary contractions and improve posture. It's also one of the safest behavioral therapies without side effects and complications. To do Kegel exercises, try stopping your urine midstream when going. The muscles you use are pelvic floor muscles. This is what you'll focus on contracting during Kegel exercises. Focus on tightening those muscles when you have an empty bladder. Hold this position for about 5 seconds at a time. Relax the muscles and then repeat 5 times. As your muscles get stronger, increase the duration to 10 seconds and 10 repetitions. Perform the exercises 10 or more times a day. Breathe normally when doing these exercises. Avoid squeezing your stomach, thighs, or buttocks instead of your pelvic floor muscles. You can also talk to a physical therapist to see if you're squeezing the right muscles. Yes, Kegel exercises works for men, too. Bladder retraining. Over time OAB causes your bladder muscles to react a certain way. Bladder retraining can help reboot your bladder muscles. The idea is to let the urge to urinate pass before going to the bathroom and gradually work your way toward longer holding times. Bladder retraining also works best alongside Kegel exercises. Perform the following steps to train your bladder. Keep a journal to determine how frequently you go to the bathroom. Delay urination with small intervals. Once you feel the need to pee, see if you can hold off for 5 minutes and work your way up. Schedule trips to the bathroom. You can keep a journal to see how often you need to go and delay the time. You can start with 10-minute delays and work your way up to every 3 to 4 hours. Most women should be able to wait 3 to 6 hours between bathroom breaks. Perform Kegel exercises regularly. A bladder retraining program can take 6 to 8 weeks to prove effective.